If we can go to the next slide, I got the next part too.
Mm-hmm.
Echo and START, because we haven't thrown enough acronyms at you yet. And so ECHO, I have to write it out because I don't ever think of what it stands for. It stands for Extension and Community Healthcare Outcomes. That stands for ECHO. And START stands for Systemic Therapeutic Assessment Resources and Treatment. But what ECHO is, and the way I think of it, is it is an, I don't want to call it, I shouldn't call it an echo chamber, but that's the visual that I've got. In an echo session, it actually came from the medical world where we needed to get increased levels of expertise in places where you might not have it. I think it started in New Mexico. So think you're in rural New Mexico and you need somebody to have expertise on diabetes. You don't have anybody where you're at in that part of New Mexico. And they said, well, let's do something online and let's have a group of people get online and we'll have part of it be a lecture and part of it just be in case presentation. And that will increase the level of expertise in those people treating diabetes in remote New Mexico. Our thought was, well, why can't we do that with mental health? And we've done that. And we started it with first episode psychosis. And now we've done it with this thing too, where we've got WISE teams that don't have the kind of expertise that we have, that we need them to have in working with autism and developmental delays. And so that's what we do with this ECHO thing. So think about ECHO as it's a chance to talk, and not just ECHO, but that it gives me a way of remembering what it stands for. More recently, we actually got some funding, and in that big old bill 5187 that's got the budget, section 215, subsection 52 says that we've got some money to continue doing this ECHO training. And in this case, we had some language that said, we really suggest that you do this START training and add that to the ECHO training. START is a way to do care coordination along with just that expertise development. And so that's what ECHO and START are. Can we go to the next slide? Why do we do this? Well, we got 1 in 6 children between the ages of 3 and 17 that's indicated with a developmental disability. And children with developmental disabilities still have mental health needs. And until recently, I don't know that was well understood or accepted. It used to be that they were kind of excluded from getting mental health services, even though they had those mental health needs. And, that shouldn't be a surprise. If you work with somebody who's got autism or developmental delay, do you think they get trauma? Yes, absolutely they get trauma. And that's a big problem. Do they have anxiety? Absolutely they have anxiety. And you see them display that in anxiety in maybe a different way than kids without autism have it, but they certainly demonstrate it. And sometimes they can't demonstrate it with words. So we need that kind of thing. Can we go to the next slide? And I got to make sure I'm not going too far, because at some point I pass this off to Kathleen. And these kids oftentimes are involved in a number of different kinds of systems. We mentioned some of them before, but if somebody's got autism, they oftentimes are involved in Developmental Disabilities Administration or DDA. Oftentimes they're part of Child Protective Services or foster care services. And unfortunately, sometimes they're part of juvenile rehabilitation where they're involved in criminal systems. And that's while that's horrific, it's a reality that we deal with. And they're almost certainly involved with having an individualized education plan in schools. And many of them have medical needs that are complex. And so we have all of these different systems that kids are involved with. And so we need a way to make sure that we got not just the ability to clinically treat these kids that have specialized needs, but coordinate the care from the different levels that they're coming at. And the level of training we do for care coordinators needs to be expanded. We're pretty good at it, but this is a complex level of coordination. And so that's where some of that START training has. What slide are we on, Jen? Do I need to pass this off yet, or have I got one more?
You have one more.
I got one more. Okay. So, oh yeah. And so when I came out of grad school 100 years ago, I remember I was trained pretty well to do clinical work, and I could do family therapy and group therapy and individual therapy. And the amount of trainings that I had on working with kids with autism and developmental disabilities, I could count on 0 hands. And unfortunately, that's still the case today. As I'm hearing people coming out of grad school say, I didn't really get any training to work with ASD and IDD, and especially one with kids that don't talk. We're pretty good at doing talk therapy, and if a kid doesn't talk, that's a real problem. And so we need to be able to do this kind of training to develop those skills that we cannot assume that clinicians are coming out of grad school or undergrad with that kind of training. And so that becomes really important for us to do. And now I think I get to pass off to Kathleen. Is that right?
You got it.
Yep. Thanks, Paul. As Paul talked about, we identified early on, I think, that well, maybe not early on, but certainly eventually with WISE, that individual behavioral health providers or WISE providers lack the knowledge and the skills to work with individuals that are dual diagnosed with autism, an intellectual disability, and a mental health disorder. And to address that, that's where ECHO was born and initiated. Next slide. Oh, I'm on the orange one. Okay. And ECHO really provides that clinical expertise, and START aims at, as Paul said, to assist in the delivery of those recommendations. So we have many experts in our state, but ECHO really looks at utilizing those experts that have an expertise in autism and intellectual disability and behavioral health disorders. Next slide. So what does that look like? For ECHO, we have a contract with University of Washington and Seattle Autism Center, who are both recognized as experts in our state. Both provide that expertise for community behavioral health providers in really digging into what's available, what is recommended. I think that as a clinician, and I think Paul touched on this too, we do not get typically trained or provided education around working with individuals with dual diagnosis. Next slide. And we have 3 different ECHOs. It started out with just one, and it was aimed at looking at intellectual disabilities in a wraparound model. Typically, those providers that are presenting to ECHO are typically WISE providers, but they're not always. Sometimes an MCO might present a case, or an individual provider. And the ECHO SMEs will provide recommendations for those providers. Our second ECHO is medication management. It was really identified that providers lack that education and expertise in medication management for individuals with intellectual disability and behavioral health, that sometimes the approach needs to be different than somebody that is typically developing. And that started maybe about 6 months ago, and it's been widely accepted. Some of the providers that present there might be an individual provider versus a WISE provider. And our last one is resource and resource navigation. For many providers and families, community partners, they struggle with knowing the resources for IDD individuals and our youth. And to answer that, the resource and resource navigation was born, and it is very well received. And I think the first ECHO presentation for resources and resource navigation probably had around 200 people attending. So it was really well received and well attended. Katrina Davis is the expert that provides that ECHO. And she is from the Seattle Autism Clinic, does a great job. Next slide. And the components of teleecho, because it is all done telephonically. And what does that session look like? It usually looks like an introduction. So a WISE provider will do an introduction of a specific case. introduce utilizing just initials. And we'll talk about what that kiddo might look like, what the historical picture looks like, what medications the individual is on. So they introduce that individual to the group. And then, the group will provide clarifying questions, and we'll have a case discussion, and we'll provide case recommendations. In there usually is a didactic. Sometimes it's presented before the case presentation, sometimes it's presented after. But that is usually what ECHO will look like, and recommendations are provided. And then that's where START follows up. START's intended, and this is the first year for START, but it's intended to follow up with those recommendations and ensure that individual continues to be provided those services that are recommended.